I found Dr. Rockmore through just referrals, word of mouth, and I had my nose done when I was 19. I'm 32 now, and it was not done the way I liked, and I needed it corrected. And I heard a lot of really great things about Dr. Rockmore, so I gave him a shot, and he fixed me.
Well, that's very kind. No, I think when we first met, you had a rhinoplasty, and I think it's always hard to take on someone who's had a result from a previous procedure that isn't happy, because you go into your first plastic surgical procedure thinking, that everything's going to turn out great, and you have your hopes up, and when things go wrong or you don't get the result that you're hoping for, I get to inherit that.
Yeah, it's very discouraging.
That emotional component to it. So what was it about your nose before that you didn't care for when I first, after you had already previously had your surgery by somebody else?
It was actually, originally I just had like a little bump. It wasn't that bad. I just didn't like it. And it ended up that it had like kind of like a ball sort of at the end, and it kind of like drooped right there. And it was just overall like kind of wider than what I started with. And so I think what you did was cartilage work, basically.
Yeah, what we did was just try to make your nose be more in balance, because the nose is always about balance. The whole face is about balance. It has to work with the rest of your features. And when we first met, you walked into the room and it didn't look like it was a natural nose. You could tell you'd had something done, but that, it wasn't something that you would see in nature necessarily. So, and I knew you were kind of emotional about it, and you met with Mom, and it was nice, but you guys were great throughout. We talked about some of the ways that we could bring it back into balance, but at the same time, more importantly, make it look natural, make it look like you had nothing done.
Yeah, I'm much happier now. I mean, obviously no one wants to have to go through it again. It's not fun to have a surgery, but it's well worth it if it's gonna be for the rest of your life. I mean, I'd rather take a couple weeks out of my life and fix something that's bothering me rather than focusing on it daily. So it was 100% worth it.
Do you ever think about your nose on a daily basis anymore?
No, it's much better. Yeah, it's 100% better. I've already recommended Dr. Rockmore to a ton of people. I work with the public as well, and it comes up sometimes. And I'm not shy about stuff, so I have recommended a lot of friends, clients, whoever, and have had several of them come to him, and they love him. Absolutely love him. And I have to say, he's got very good bedside manner. He's just very easy to talk to, unlike a lot of other doctors I've talked to that are very, very clinical and professional, and yeah, nothing but good things.
Thank you. No, thanks for sending people. I mean, to me, that's the ultimate compliment, is to have someone believe in you enough to send someone else, because when you refer someone, you're putting your name on it too. So I thank you for it.